This week, a look at the first 6 months of Minnesota's paid leave program. North Memorial and Sanford make a case for partnership and possible big changes to the 340B program. Welcome to the July 10th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mochtig.
The state of Minnesota offered a look this week into its major new workforce program, paid leave, at the 6-month mark. Minnesota joined 13 other states offering paid leave programs in January. Officials with the State Department of Employment and Economic Development said the agency had so far approved paid leave for nearly 75,000 Minnesotans from among just over 100,000 applicants. Deputy Commissioner Evan Rowe said non-approved applications had been withdrawn or didn't meet application criteria, like including supporting paperwork or offering valid identification.
Medical leave has been projected to be around 50% or more of total claims as we go along, and that's roughly what we're seeing. And I think we'll see that medical percentage tick up over time. Caring leave, about 14%. And then safety and military family leave are much smaller in terms of total volume of applications.
But the 6-month numbers are running ahead of pace for the program's first-year projections, which anticipated 130,000 approvals. Rowe noted that included an initial surge of parental leave applications dating back to 2025.
Obviously, we are seeing very robust interest in this program, but I would say that it's something that we're continuing to monitor closely.
So far, the state has paid out about $600 million in claims through the end of June. The program got $668 million in initial funding from the state and collected $344 million in premiums from workers and employers in the first 3 months of 2026, suggesting that the program will at least initially be solvent. The Star Tribune noted that healthcare providers, including hospitals, reported they were struggling to backfill for workers on leave, particularly with highly skilled and specialty occupations and requests for intermittent leave. The readout also coincided with a report in Bloomberg this week that leaves of absence across the U.S. workforce were rising sharply, with more than 2/3 of employers telling a survey in May that mental health leaves were a major factor in that phenomenon.
Also this week, Attorney General Keith Ellison held a public forum at a North Minneapolis church, offering the public the opportunity to comment on the proposed partnership between Sanford Health and North Memorial Health. The AG doesn't have jurisdiction to approve or deny the merger, but could oppose it in court, blocking Sanford's initial entry into the Twin Cities hospital market. Testimony included some opposition by organized labor groups. But North Memorial CEO Trevor Swalish urged the community and state authorities to support the deal. North Memorial reported a $50 million operating loss last year, despite cutting more than 100 jobs in 2024.
That opportunity is to not only stabilize North Memorial, not only keep us around and doing the things that we've done for this community for over 80 years, but it also is about making things better and doing things better and serving the community in a way that we can't currently do that alone.
Sanford has committed to investing more than $600 million into North Memorial's Robbinsdale and Maple Grove hospitals. Sanford expects the agreement to be final later this year.
It was also a momentous week in Washington, D.C. Ellen Florek has more.
2 separate bills that would pare back the 340B drug pricing program were circulating around Congress this week, with potentially major consequences for the $1.3 billion in proceeds Minnesota providers earn from the program annually. The Senate measure would authorize controversial rebates in lieu of discounts, or give hospitals the alternative to give immediate discounts directly back to payers. A House bill would pause rebate programs for 4 years, but add more record keeping and more narrowly define eligible patients. Also in Washington this week, CMS published new outpatient prospective payment system rules that would slash Medicare reimbursements for 340B drugs from the current 106% of average sale price to 66% of average prices, a 40% cut that would effectively take back most of the program proceeds that Congress offered to the healthcare providers when the program started more than 30 years ago. The bills may not progress far in the divided Congress, and the CMS rules are still only proposed, but they could mark a profound shift in the program and mean potential financial difficulties for hospitals and clinics if they go into effect.
And a final note, a new analysis by National Nurses United released this week suggests that more than 600 hospitals nationwide, including 18 in Minnesota, could see significant financial impact from Medicaid sequestration and enrollment cuts and expiration of ACA premium subsidies for patients. The Nurses Union said the median projected loss at financially vulnerable hospitals is about $4 million annually per hospital, although a small number of large urban hospitals could lose $180 million a year or more. Minnesota lawmakers passed a $205 million rescue package for Hennepin Healthcare in May after the hospital projected a $50 million loss this year and an operating deficit expected to reach $1.7 billion by 2036.
That's it for This Week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Abby Mocktig.
And I'm Tim Nelson.
Thanks for listening.